In this video, we'll guide you through the next exercise, engaging a full arch upper Smartwire on the training Typodont. In the next few exercises, we'll be working with the training Typodont, which is designed to closely replicate working on a patient. Position the Typodont as if you are working in the mouth while seated at the 12 o'clock position. The upper arch should be closest to you, and the lower arch should be positioned further away. Before beginning this exercise, please pause this video if needed and retrieve an engager, lingual Weingart, the training Typodont, and the upper Smartwire, which is stored in the case located at the back of the Typodont. You may need to use the Weingart plier to pull the case out of the back of the Typodont. Now let's begin the exercise. For a right-handed operator, use the Weingart plier to lightly grasp the neck of the upper left first premolar locket and place it in the bracket. Use your left hand to hold the locket in place while switching to the engager to complete engagement. For a left-handed operator, begin with the upper right 4 instead. Proceed with engaging all the brackets using the same engagement technique discussed in earlier videos. Seat the locket with the Weingart, switch to the engager, position the engager with proper angulation, push on the bend of the engager with your non-dominant hand, switch back to the Weingart, and repeat the process until all lockets have been engaged. One of the most important steps to emphasize is proper initial seating of the locket. The legs must be positioned mesial and distal to the gingival tab before you switch to the engager. To help achieve proper initial seating of the locket, when holding the neck with the Weingart, slightly twist the locket so that the legs enter the bracket first, and then guide the locket fully into place until you feel that it's seated securely. Once it's properly seated, then switch to the engager to finish the engagement process. Twisting the locket and seating the legs first is especially important in crowded, narrow situations like the upper left 3 and 2 in this model, where the interproximal loop overlaps on itself. Sometimes it's also necessary to hold the locket in place with your finger after seating it in the bracket with the Weingart when switching to the engager, like shown here for upper left 2. Finding a comfortable chair position and hand position for both the engager and Weingart plier is user-dependent and may take some practice to see what works for you. The following recommendations provide a good starting point that you can modify based on your preferences and ergonomics. One suggestion for using the engager intraorally is to use the straight end when engaging upper right 2 and 3 for right-handed operators. While the rest of the teeth can be easily engaged with the angled end technique, the cheek prevents easy access for upper right 2 and 3, where you may find it easier to switch to the straight end of the engager for engagement, like shown here. For left-handed operators, this applies to the upper left 2 and 3. Chair position for the upper arch will range between 1 o'clock, which is slightly to the left of the patient, to 11 o'clock, which is slightly to the right of the patient. For right-handed operators, a good starting point is 1 o'clock for the posterior teeth and 12 o'clock for the anterior teeth, like shown in this image. From there, adjust your chair position as needed based on what feels most comfortable and provides the best access. For left-handed operators, the opposite is recommended, using 11 o'clock for the posterior teeth while maintaining the same 12 o'clock position for anterior teeth. When working on a patient, it can also be helpful to have the patient turn or tilt their head as needed to improve your access and visibility. Finish the engagement process by double-checking that all lockets are fully seated by applying labial pressure with the engager. This completes this exercise on engaging the full arch upper Smartwire on the training Typodont. In the next video, we'll guide you through engaging the lower Smartwire on the training Typodont.